Assalamu alaikum. Following the Ramadan Health Fact Sheet 2021 by the Muslim Council of Britain and British Islamic Medical Association, the use of oral and nasal medications, including inhalers, nebulizers, nasogastric intubation, and bronchoalveolar lavage, will result in a void or broken fast. When an agent of consequence reaches the throat, stomach, intestine, or a cavity that has a path immediately or via another cavity to any of these three and settles therein, the fast is broken. An agent of consequence is one that has nutritional or medical benefit or has been introduced by oneself. Essentially, this means guidance around the use of oral medication during fasting has not changed, and taking oral medication in tablet form or spray will result in a void or broken fast. However, if you live with the following lung conditions such as chronic obstructive pulmonary disease, COPD, or asthma, the use of an inhaler or nebulizer will result in a void or broken fast as the medication will pass the throat. If you live with cystic fibrosis or bronchiectasis, the use of a nebulizer will result in a void or broken fast as the medication will pass the throat. The use of an inhaler or nebulizer for any other condition will also result in a void or broken fast as they pass the throat. The use of a nasal spray for the treatment of hay fever, sinus, sinusitis, non-allergic rhinitis, nasal polyps, nasal congestion, or any other condition will result in a void or broken fast as they too pass the throat. Nevertheless, do note that there may be a difference of opinion amongst the different schools of jurisprudence. Therefore, people are advised to refer to scholars of their choosing for their specific cases. In order to continue fasting with such conditions, it would be advised you speak with your healthcare provider to rearrange the prescription of the medication so they may be taken at non-fasting hours or the possibility of a change in a medication. In regards to asthma or hay fever, it is helpful to be aware of the triggers. Some are avoidable, such as cigarette smoke, but it's impossible to completely avoid others, things like pollen, pollution, and cold weather. The good news is there are proven steps that you can take to cut your risk of asthma triggers causing asthma symptoms or an asthma attack. 1. Take your preventer medication every day. The best way to help your body cope well with asthma triggers is to take your preventer inhaler every day as prescribed. Your preventer medication works away in the background to help inflammation and sensitivity in your airways. You can take your preventer inhaler during suhoor. Taking it every day and the right way means there's less chance of a reaction if you come into contact with any triggers. 2. Use a written asthma action plan. Use your written asthma action plan to note down your triggers so you can spot when your asthma needs extra help. Using an action plan helps you manage your symptoms so you're less likely to break your fast or end up in hospital for your asthma. You can find the link to the asthma action plan in the description below and fill it in with your GP or asthma nurse. 3. Go for an asthma review now. An asthma review gives you and your GP or asthma nurse a chance to make sure your written asthma action plan is up to date and how to manage your fasting. You can check you're taking the right medicines at the right doses so you're getting the best protection against your triggers and cutting your risk of an asthma attack. You can also check you're using your inhaler in the best way. It might be that something as simple as a change of inhaler technique could help you manage your asthma better. Hay fever can be unpleasant and have debilitating symptoms. Sometimes it can be relieved by avoidance of the allergic triggers and the use of antihistamines to minimize your triggers. Monitor pollen forecast daily and stay indoors wherever possible when the count is high, generally on warmer or drier days. Rain washes pollen from the air, so counts should be lower on cooler, wet days. On high pollen days, shower and wash your hair after arriving home and change your clothing. Avoid drying washing on a clothesline outside when pollen counts are high. Apply an effective allergen barrier balm around the edge of each nostril to trap or block pollen and other allergens to help prevent a reaction. Some may find they are able to fast by taking antihistamines at suhoor, while others may not. Therefore, for all conditions where there is a need to take oral or nasal medications, including inhalers and nebulizers, while fasting, please discuss with your healthcare provider and local imam for specific and individual guidance. Remember, this information is all free, so don't forget to subscribe, like, share, or follow Conscious Bites Dietitian.